typically families have a lot of questions when we have a baby in the NICU, and there's a lot of things because there's been something that's come up that's made things not go the way that we planned them to go. And that's why we have our NICUs, to take care of those very special little babies. And so there's a lot of information that we throw at families, and there's a lot of things that come up. We want to involve our families and our parents as soon as we can, and they can be involved right from the beginning with each of the babies that are in our NICUs across the Aurora system. We do have family-centered care, and caring for the family as a whole is really important to all of us. The things that you can expect with a premature baby, depending on how sick they are, sometimes they need to have breathing machines to help them breathe, and there's all kinds of things that go along with that. Some machines are a little bit more than other machines. We don't know exactly how to predict that before a baby's born, and it depends on the level of prematurity, but we can give a baby a little bit of oxygen through a nasal cannula, or they may need to actually have a tube into their lungs to breathe for them, and so every baby's a little bit different. So that's one of the things that we can expect. Most of our babies are on heart monitors to tell us what their, it is an intensive care unit, and we have to remember that, and so we need to watch their breathing and their heart rate, as well as their blood pressure sometimes. Most of our babies do have IVs as well. Our very sick babies can have IVs that go into the umbilical cord, and we can actually draw blood off of that and give IV fluids to take care of the baby until they're well enough to eat. We also have isolettes or warmers, like you can kind of see behind me. We have a warmer to help the baby maintain their temperature. Premature babies do not have the ability to regulate their temperature the way a big term baby would, because they're tiny, as well as they don't move around as much as a term baby does. So we do try to keep them very warm, and the isolette does that, or the warmer. We have a pulse oximeter to tell us how much oxygen the baby's getting as well, and their blood level. And then there's all kinds of other things that the baby might need depending on how sick they are.